Hello everyone. Today we'll be studying a very important and a very basic topic in pharmacology, that is enteral routes of drug administration. What are the learning objectives for today's session? At the end of this session, you should be able to enumerate various enteral routes of drug administration. You should be able to describe the advantages of various enteral routes using suitable examples. And you should be able to describe the disadvantages of various enteral routes using suitable examples. So why you need to study this topic? Because any route of administration that is chosen may have a profound effect upon the speed and efficiency with which any drug can act. In the enteral category, there are majorly three types of routes. Number one being oral, number two sublingual, and number three the rectal route of drug administration. Coming to the oral route, it is the easiest and the most common route with which we have all must have taken the drugs. As you can see in the picture, the female is taking the drug by the oral route with a glass of water. She is going to swallow it. So what are the advantages? It is safe. It is convenient and cheap. You do not need any additional equipments for any drug to be given by this route. You need not sterilize the drug while giving by the oral route. It is non-invasive and both solid and liquid dosage forms can be given orally. The disadvantages include absorption is inefficient. It is not 100% absorption. The oral route is liable to effect of gastric juices like penicillin G and insulin. You all know insulin is a protein, and gastric juices contain proteolytic enzymes, so this can be degraded by the gastric juices. So insulin is unsuitable to be given by this route. Then some drugs are destroyed in liver, for example glyceryl trinitrate, testosterone and lidocaine. If a drug is unpalatable in taste, for example chloramphenicol, you cannot take the drug by oral route. Then first pass effect. What do you mean by this? We'll study this topic in detail in the subsequent lectures, but what you need to know is this is metabolism before the therapeutic effect can be achieved. So any drug with high first pass metabolism is unsuitable to be given by oral route. Certain drugs can irritate the gastric mucosa, causing nausea and vomiting. The most common in this category are the painkillers, some antibiotics. So you cannot give the drugs by this route. It is a limitation. Oral route is relatively slower in action as compared to the parenteral route, which we'll be studying in the next class. So it is not suitable for emergency, and oral route is not used in unconscious and uncooperative patients like children or patients with mental disorders. Coming to the second category, that is the sublingual. The sublingual route, in this the drug is placed under the tongue, as you can see in the picture, and after the desired effect the drug can be spit out. The examples of drugs which can be given by this route are glyceryl trinitrate, buprenorphine and desamino-oxytocin. The advantages are it has rapid absorption because through the sublingual vein the drug goes directly into the systemic circulation, so it is useful in emergency. This glyceryl trinitrate is given in patients with an attack of angina by the sublingual route, so it is useful in emergency, and there is no risk of first pass metabolism in the sublingual route in spite of being an enteral route, because here the drug is absorbed directly into the systemic circulation. The disadvantages are only lipid soluble drugs can be given, only non-irritating drugs can be given by this route. It is somewhat inconvenient to the patient. You cannot give large doses to the patient by this route, and the unpleasant taste of some drugs makes it unsuitable to be given by sublingual route. Coming to the third route in the enteral category, that is the rectal route. In this, The drug is put into rectum as suppositories or retention enema for systemic effect. Examples are paracetamol, diazepam and indomethacin. The advantages are it can be given in unconscious patients and children. In fact, the rectal route is most commonly employed for children. It can be given in nausea and vomiting, because when the patient cannot swallow the drug because of severe nausea and vomiting, you can give the drug by the rectal route. It is easy to terminate exposure once the therapeutic effect is achieved, and it is good for drugs affecting the bowel like laxatives, which are given for constipation. The disadvantages are it is inconvenient to the patient, it is embarrassing, especially for an adult patient. If you have to give the drug by this route, you need privacy. Absorption is slower, irregular and unpredictable, and some drugs can cause rectal inflammation. So this is all about all the enteral routes of drug administration. I'll end my presentation by saying that no single method of drug administration is ideal for all drugs in all circumstances. Depending on the physical and chemical characteristics of the drug, depending on the profile of the patient to whom we are treating, we need to individualize the route and we need to choose which drug will be suitable for that particular patient. Thank you very much for your kind attention.